Hey guys, welcome back to Loop Hub. Today we'll talk about the most disgusting moments on Dr. Pimple Popper. Let's head into it. Number 1. Fat lump on shoulder. After noticing an apple-sized lipoma on his sister's shoulder blade, one of Dr. Pimple Popper's admirers sent her to the celebrity dermatologist. Dr. P, whose real name is Dr. Sandra Lee, detailed her treatment in a video posted on her YouTube account on February 17th. Dr. P used an injection to numb the woman's shoulder blade area before making an incision through the lipoma center to drain its contents. A lipoma is a fat-filled tumor that develops between the muscle and the skin. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches. A lipoma is usually not cancerous, but if it hurts or irritates the person who has it, a dermatologist can remove it. The lipoma's yellow fat deposit protruded from the incision almost immediately. When it began to bleed, Lee used a cauterizing pen to seal up microscopic blood vessels beneath the skin, preventing more blood from leaking. She claimed that by going through this procedure, she was able to perceive the progress more clearly. As she worked on it, Dr. P then pushed around the fat deposit with her gloved fingers, loosening it from the woman's skin walls. She was then able to squeeze around the incision, causing the lipoma to pop out. Lee remarked, "It's like you're having a kid," alluding to the big chunk of sticky fat. Dr. P extracted the fat mass from the woman's body with surgical scissors and her fingertips. She pressed and poked around the wound a few more times to make sure she got all of the fat out, then closed the cut with sutures to let it heal. Lee then advised the woman to take a picture of the fat mass to show her brother, the pimple popping fan, how it looked. Number 2. Golf ball sized cysts. Dr. P generally only sees one patient at a time, but on tonight's edition of her show, she treated fraternal twins who had the identical skin disease. Dr. Sandra Lee saw Tracy and Stacy from National City, California, after they both acquired several golf ball sized lumps on their scalps. She said they initially noticed lumps about 15 years ago, and they've been happening ever since. Tracy and Stacy decided to attend Dr. Pimple Popper together after their daughters advised them to get these lumps looked at for health reasons. Their growths were diagnosed as pillar cysts. Pillar cysts are flesh-colored bumps that can develop on the surface of the skin. They're sometimes called tricholemal cysts or WENs. These are benign cysts, meaning they typically aren't cancerous. Although pillar cysts aren't necessarily a cause of concern, you may find them uncomfortable. Pillar cysts are the most frequent type of cyst, and they most commonly appear on the scalp. According to the National Institutes of Health, pillar cysts affect less than 10% of the population. When keratin, a protein contained in skin cells, is removed from beneath the skin, it appears as thick, white liquid. These tumors aren't inherited, which explains why the sisters were the first in their family to develop pillar cysts. Their identical genetics, on the other hand, could indicate that they have similar skin types, which, according to Lee, could explain why they both had the skin problem. Dr. P began by injecting a numbing medication into each of the cysts. She cut right through the core of the largest cyst behind Tracy's ear, which immediately injected grayish-white substance that looked like mustard. According to Stacy, Lee was able to get rid of the rest before moving on to the second one, which had a more oatmeal-like texture but erupted in the same way as the first. When Dr. P started treating Stacy's final growth, she remarked, "Brace yourself for impact." Lee was able to successfully remove the cyst and sew all three up after even more spurting. Stacy was the next to go, and her cysts were a little more difficult to remove. This is due to the fact that some of them had opened and oozed over time. When the cysts healed after they had opened up, scar tissue formed on the inside of her skin. Lee described Stacy's growth as a little more like putty. Lee was able to quickly remove one of Stacy's 3 cysts in the center of her head. After numbing them, it caused a large hole in Lee's shirt, which he patched up. Because of their thickness, the other two proved more challenging, but Dr. P continued, squeezing out the yellow and brown insides with her fingertips. The final cyst even put on a show, squirting so forcefully that it splattered all over Lee's office walls. Lee sewed up Stacy's cysts and sent her on her way, just like she did with Tracy. Tracy explained, "Sisters who spray together stay together." This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.